Hello people, in this video let us look at sexually transmitted diseases. So first of all, look at the list here. You have bacterial agents like gonorrhea, you've heard of, trachoma, syphilis, Treponema pallidum, right? Then Haemophilus ducreyi, this will cause what? Chancroid, Mycoplasma. So many are there, guys. We'll look at the important ones. Coming to viral agents, can you think of some? Herpes, human papillomavirus, very good. This can cause cervical cancer, oral cancer also. Molluscum contagium is also transmitted sexually. Then you have obviously the human immunodeficiency virus, which causes AIDS. Then you have some protozoal agents also, guys. Let's look at these. Entamoeba histolytica. So what will this cause? What is it called as Entamoeba histolytica? Dysentery, Giardia lamblia, Trichomonas vaginalis. Okay. This is actually causing Entamoeba histolytica causes amoebiasis. Let's move on, guys. There are some fungal agents also that you need to know, like Candida. Candida can go in sexual route. Then you have ectoparasites. Parasites like scabies, right? Scabies. Then you have Therus pubis. It is crab louse, right? Crab louse. Now that you know the agents, guys, look at the diseases caused by these. Some few names you can remember. Human immunodeficiency virus, AIDS, that you know. Then gonorrhea, Treponema pallidum, syphilis, Haemophilus ducreyi, chancroid, chlamydia trachomatis will cause lymphogranulomatous venereum, right? Then urethritis, cervicitis, then proctitis, epididymis, infant pneumonia, Reiter's syndrome, pelvic inflammatory disease, neonatal conjunctivitis, isn't it? Neonatal conjunctivitis, okay. But what is LGV? Yes, it is lymphogranuloma venereum, okay. Then what else you know, guys, in the names? Do you know anal warts? Human papilloma virus will cause warts, that you can write. Then herpes, genital herpes. Hepatitis will cause hepatitis, okay. Then molluscum contagiosum, you'll have genital molluscum contagium, you know, those things which will give toothpaste like substances. Yes. Then Candida albicans vaginitis and Trichomonas vaginalis vaginitis. Candida albicans vaginitis, this is very easy for you, right? You will write this, okay. Then for treatment of these STIs or RTI, which is reproductive tract infection or sexually transmitted infections, under NACO, that is National AIDS Control organization, you have Suraksha Clinic, right? You have Suraksha Clinic services. Then here you have pre-packed STI, RTI color-coded kits. This is very important. So you have so many colors for these. Look at these. Look at the kits, then you will understand better. So you have gray, green, white, blue, red, yellow, black. You have to remember the order, then it will come, it will place in your mind, okay? Gray, green, white, blue, red, yellow, black, okay? Did you get it? How many kits are there? 7. Very good. So here they are telling you how to manage all this with these kits. Same thing. Here the order of the color has changed. Leave this, okay? Then we will go here. So you have what and all kits? 7 kits are there. Gray. Gray is for what? Urethral discharge. Where is the gray? Okay, gray is for urethral discharge, anorectal discharge, cervicitis. Mainly remember urethral, okay? Urethral discharge, anorectal discharge, cervicitis. Then kit 2 is green. Green again is this kit 2, it is for women, right? Vaginitis. So kit 2 is green, vaginitis. Can you remember this? Then white is for genital ulcers, blue is for genital ulcers, red is for genital ulcers. All these 3 are for genital ulcers, which is very good. 3, 4, 5. 3 is what? White. Then you have blue. Then you have red. Okay. Then yellow is for lower abdominal pain. Black is for inguinal bubo. Is this enough if you know this much? Of course not. You should know the content of the kit also. Right. Anyways, we will look at them. Look at this. Same thing. So first one is what? Gray for urethral, anorectal, cervical discharge. You can remember. Mostly you can remember urethral, anorectal, okay? That time you will be able to understand. This is grey color. What will it have? Azithromycin, cefixime, okay? Vaginal discharge, next kit is green color, vaginal discharge, vaginitis. What and all you have here? Secnidazole and fluconazole. Can you remember this at all? Then the next three are genital ulcers that you can easily say. The colors are what? White, blue and White, blue and red. All these are genital ulcers. Especially the red one you should know, because the red one is herpetic. Okay, so guys focus. Red is what? Herpetic genital ulcers, which is caused by herpes. So this is the herpetic kit. It is red is for herpes. What will it contain? Acyclovir. Okay, just remember acyclovir enough. Okay, then coming to lower abdominal pain, kit 6, yellow, pelvic inflammatory disease. Okay, yellow. Touch your pelvic inflammatory disease, yellow kit. Okay, what will it have? Cefixime, metronidazole, doxycycline. Cefixime, at least cefixime you remember. Okay, then coming to the last one, guys, black. Last one is what? Kit 7. It is black. Black will have doxycycline. If you notice, doxycycline is there in quite a few of them. Doxycycline is there in the black one, the blue one and the yellow one. Do you want me to use specific colors while writing this? Okay. So doxycycline is main in the black and blue one. At least that much you remember. In the blue one, what is it treating? Genital ulcer, that is non-herpetic kind. Okay. And what is the black one for? Inguinal bubo. Okay. Can you say it now? Gray. Very good. I will try to use the same colors if possible. Gray is having azithromycin. It is for urethral discharge, anorectal discharge, cervicitis. Very good. Then coming to green. Green is for vaginal discharge. Vaginal discharge, vaginitis. Yeah, vaginal discharge syndrome. This is having secnidazole. Very good. At least that much you remember. Secnidazole. Then coming to white. White you will not be able to see. I'll have to use some better color. Okay, white. White will have something. What is this? Benzathiane penicillin. It has penicillin. As simple as that. It has genital ulcers. Okay. Again, this is not the herpes kind. Then coming to blue one. Blue one, guys. Blue. Blue has doxycycline. You already know. So basically, it will have. It's for what? Non-herpetic, again genital ulcer. Then coming to red. Red you know very well. It is for herpetic genital ulcer. It has acyclovir. A. Why did I write here? It should have been. I should have written R here, right? Red. Herpes. Acyclovir. Okay, very good. Genital ulcer. Very good. You got the red one, right? Then coming to kit 6. Kit 6 is yellow. Yellow is for what? Yellow is for lower abdominal pain, pelvic inflammatory disease. Very good. What does yellow have? Cefixime. Can you remember this? Yellow cefixime. Okay. Then coming to the last one. The black one is for inguinal bubo. It has azithromycin. At least remember this. It has doxycycline also. Very good. That's it for now, guys. Under STD, STI, RTI. Okay. Hope you have learned something. Green and yellow female. Green and yellow female. Green and yellow female. Green is having secnidazole. Is for vaginal vaginitis. Then yellow is for pelvic inflammatory disease, again for female. So green and yellow female. Everything else shared. Okay.